Next on AM 1480 WLEA, the Newsmaker Show. Here's Brian O'Neill.
Well, we have a urologist, the new urologist at St. James, Dr. Ajay, here along with a hospital spokesperson, Kate Kreger. Want to welcome you both to the Newsmaker Show today.
Thanks,
Thank
Brian.
you.
I have to tell you, this is urology related. And for the person who called yesterday, don't worry, I won't say your name. So I get a call yesterday, and it starts out, the woman said, "Did Elder Bush fall?" So I'm like, "Did Elder Bush fall?" Okay. So we worked through the conversation, and eventually we figured that Elder Bush is George H.W. Bush, who died some time ago. And she said, "Did I hear in the news, I don't know if it was your station or not, did I hear in the news that Elder Bush fell?" So we worked through that, and I explained the difference between W and HW, and the HW has already died. So anyway, what she was referring to was former President Jimmy Carter, who's now 95 years old, fell and broke a pelvic area. And tying that in, it took us a while to work out this phone call. Anyways, tying it in, I looked up Dr. Divya Ajay and the U of R's website, and it talks about how that's one of your specialties. She's a urologist at St. James. And so I believe you just started at St. James, Dr. Ajay?
Yeah, I started a month ago, yes.
And are you in the what we call the old St. James, or are you in the medical office building?
Yeah, in both. So we see patients in our outpatient clinic in the medical office building, and we're currently offering surgeries in the old hospital.
That's great.
Yeah, that's
and
change
if we could,
soon.
I always ask St. James. Kate knows this. I always ask these questions. How are things coming in the new St. James building? Do you have an office there yet that you've seen the inside of, or just the inside of the hospital?
Well, we're about 85% complete with the construction, Brian. And when people drive by, they can see the logo is on the building, and there's paving, and there's landscaping, etc. So really most of the work is happening on the inside now, and we're still targeting March of 2020 as a move-in date. But you ask about seeing the inside. In the next week or so, we're going to release a video, a kind of a virtual tour of the new hospital and where it is to date, so people can be watching for that.
That's great. So I'm just pulling up Dr. Ajay's bio on the University of Rochester's medical page. It says you went to Duke, North Carolina, and Chapel Hill, and University of Texas, and the Cancer Center in the Anderson Cancer Center in Houston, Texas. So.
Yeah.
A lot of big name schools there, Doctor.
A little bit all over. Yeah, I did my residency at Duke, and I did a master's in public health at UNC. So I am a Blue Devil at heart, but I also support UNC. And I did a fellowship in pelvic reconstruction at MD Anderson Cancer Center in Houston, Texas.
And as we mentioned in the beginning of the show, that's big in the news now with the 95-year-old former President Carter falling and breaking, I believe, his pelvis. That's a topic that a lot of older listeners, I imagine, would connect to, because as everyone knows, as you age, a fall is not like it is when you're 3 or 4.
Yeah,
It's
absolutely.
much more damaging.
Urology is definitely a specialty for all ages, but a lot more for the elderly. I would say the most common conditions we see are probably blood in the urine, having a high PSA or a prostate-specific antigen, which could indicate that you may have an inflammation or cancer in your prostate, and voiding dysfunction, so trouble with peeing, either going too much or too little, or just being unhappy with the way you're urinating. Those are sort of the most common conditions we see, and while it can affect anyone at any age, there's definitely a higher prevalence of older patients who have these conditions that we're happy to help here in Hornell.
So I'm reading over a list of, not being an expert on this. Usually I'm the political talk guy, but urology, you deal a lot with things like kidney cancer, kidney stones, bladder cancer, as you just said, bladder and urinary problems and blood in the urine. I also see prostate cancer, adrenal tumors, enlarged prostates, fertility issues, and I wouldn't even try to begin to pronounce some of these words, but because medical terminology.
Yeah, so to summarize, we would see any man or woman with genitourinary issues. So anything that, starting from your kidney to your ureter, your bladder, your urethra, the prostate in men, the vagina in women. And, we also see erectile dysfunction, sexual dysfunction, things of that nature. So the whole gamut, really.
So you've come to Hornell. I'm guessing the hospital found you and recruited you. And Kate, you could feel free to jump in this answer. How did you get to Hornell, doctor?
So I am with the U of R, and I'm going to be practicing both at Strong and in Hornell. And this place is beautiful, and it doesn't, there seems like there is a need for some urological services, although Dr. Naga is doing an excellent job. So we're here to supplement his services and, provide any local urological services that we can.
Okay, and that was another question I had. I wasn't sure. But Dr. Naga, what the status was there. He's staying on, and
yeah. Dr. Naga is still practicing, and Dr. Ajay, as she said, will be supplementing what he does, and we're just expanding what we can offer here in Hornell.
Great. So going back to the medical school years, doctor, and I'm not sure I want to get incredibly biographical here, but at what point when you're in medical school do you decide that you want to go for this specialty?
So urology is actually a really interesting and diverse specialty. We are one of the first specialties to start using robotics. We use a lot of laser and endoscopic technology. We really are kind of at the cutting edge of a lot of technology and a lot of new developments in medicine in general. It's also a specialty where we follow our patients for a long time and have a very intimate and relationship with them, sort of really helping them with kind of their most personal needs. So, it felt like a really good fit. I really liked my colleagues, and I really enjoyed doing a lot of research in cancer survivorship and quality of life care and, surgery of that nature. So, I'm happy to offer those services now here.
Is cancer a lot of what you work with, doctor?
I am a reconstructive urologist, so I do a lot of sort of post-cancer care, so what I call cancer survivorship. So after you have, battled through the cancer, if you have complications from the cancer, whether that's peeing too much, peeing too little, having scar tissue in any of the tubes that require you to empty your bladder, we kind of help dealing with all of that.
Talking with Dr. Divya Ajay, a new urologist at St. James, who's just recently come to the area. And when I say recently, am I correct to say it's just the last couple of weeks, doctor?
Yeah, that's correct. Yeah, we've just started out here. We'll be at the medical office building on Seneca Drive, and then at the main hospital in St. James for our procedures and surgeries.
Kate, Kreger question. How are things going with the new medical office building?
Oh, it's going great, Brian. We've got all kinds of new specialties there. We've brought on Brian O'Donovan was telling me we've recruited 10 new physicians this year alone, and a lot of those physicians are located in the medical office building because they are specialists. But we also have a couple of new hospitalists who are the physicians who take care of you when you are a patient in the hospital. We have Dr. Shane Varghese, who's going to be joining us next week as a hospitalist. Dr. Sachin Manthirathil, and I'm sorry if I messed his name up, who started as a hospitalist a couple months ago, very well liked, working with Dr. Randawa to take care of patients in the hospital. And we're continuing to recruit for new specialists who can serve out at the medical office building and ultimately at the new hospital. So we're continuing to look at the needs of the community. What is it that we need here so that patients don't have to travel very far?
And talking on today's Newsmaker Show Live with Kate Kreger, hospital spokesperson, and Dr. Divya Ajay, a new urologist with St. James Hospital. Doctor, in one of your answers a few minutes ago, you talked about the new technologies in the world of urology. Wondering if you could tell us, what's new out there and what kind of technology do you have in the medical office building, and what kind of technology will you have at the new St. James when they open up, and I believe that's March 2020?
Yeah, so there's a lot in urology that's new. We're going to try and see, how much we can expand the St. James Hospital and try and provide as many procedures and surgeries that we can locally. But I suspect as we start off, we're going to be doing a lot of diagnoses here and then kind of appropriately treating patients where it's safest, whether it's down at St. James or up at Strong or any other facilities, that we have access to. But hopefully, we can keep all of our kidney stones and we can start doing sort of smaller procedures here and then kind of build it up as we have more resources and more patient interest.
Okay, going to take a quick break talking with Dr. Divya Ajay, new urologist at St. James, as well as the hospital spokesperson Kate Kreger. Stay with us.
Know where you can find all your favorite Skechers shoes in one place? Skechers.com. Because at Skechers.com, we have miles and miles of styles of the most comfortable shoes on the planet. We have boys and girls shoes that sparkle and light up. Skechers.com has work shoes, slip-ons, sports shoes, casual shoes, canvas shoes, go walk, go run. The styles are endless. And on Skechers.com, you can find all the fits you need. Plus, so many shoes with Skechers exclusive air-cooled memory foam. So find all the styles, all the fits, and all the comfort. Only at Skechers.com.
There's nothing like meeting face-to-face, and there's nothing like Zoom to make that happen. Zoom lets you connect and do business across town or around the world. Zoom ties together all of your communication needs into one easy platform for video conferencing, phone calls, group chat, webinars, and your conference rooms. Connect easily from anywhere, your mobile phone, your laptop, or conference room. Zoom is how business gets done. Get your free account at Zoom.com today. Meet happy with Zoom.
The Hornell Area Arts Council presents 2 Nights of Terror Zombie Buffet. This haunted house will be held at the Hornell Community Arts Center on Broadway, October 25th and 26th. Light scare for the young and nervous from 7 o'clock to 8 o'clock. Regular hours from 8 to 11. $5 admission. Co-sponsored by Logos Print Shop of Hornell. Proceeds benefit the art programs of the Art Council and Arts Center. Come if you dare. 2 Nights of Terror Zombie Buffet. Friday, October 25th and Saturday, October 26th at the Hornell Community Arts Center. Follow us on Facebook.
And we're back here on the Newsmaker Show. Brian O'Neill live with two professionals from St. James Hospital. We have Dr. Divya Ajay, the urologist and hospital spokesperson, Kate Kreger. So I wanted to ask you, as far as your patients go, most of them are probably, 55 and over?
I would say there's a whole range, but we tend to kind of see a higher population of and that's true about healthcare in general, right? Yeah, tend to see a little older patients above 50, which I wouldn't even consider old, but but yeah, that's true about healthcare in general, really.
And is it more men or more women? Is it down the middle, kind of both, same amount?
I would say both, yeah.
Okay. As far as children go, I'm guessing that the average problem for a child would be, or a younger person would be maybe a sports injury that you might see someone for.
So in children, we would see patients for hypospadias, for reflux, so infections of the kidney or the bladder,
and what was the first word you used?
Hypospadias. So when your urethral meatus, the hole that you pee out of, is not at the very tip of your penis. So these are all reconstruction issues, and obviously there are urological cancers that unfortunately do affect little kids as well. I do have colleagues up in Golisano Children's Hospital that have about 2 to 3 years sort of extra training in treating children, and in general, I would defer to their expertise in managing children, because they are a lot more complicated than little adults. We need sort of specialists who do anesthesia for children. We need many other specialties to kind of treat children. But obviously, if there's an emergency, we are here and we are competent to be able to manage things that are needed. But if it's an elective sort of situation, I would strongly recommend people make appointments at the Golisano Children's Hospital with our pediatric urologist there.
Tom Golisano, interesting guy. He's Rochester, Buffalo area billionaire and very generous with his money. That was a name that came up in politics a lot, about 10 years ago. He was very involved with the Republican State Senate. We're talking live this morning with Dr. Divya Ajay and Kate Kreger, and they were talking about how a lot of the children's cases end up at Golisano's Children's Hospital in Rochester. I didn't know that. Is Golisano's Children's Hospital affiliated with U of R?
Yes, it's a standalone facility right on the U of R campus, so adjacent and connected to Strong Memorial.
Okay, that's very nice, and quite the benefactor there in Tom Golisano. We talked about types of conditions. Well, I talked a little bit about types of conditions in segment 1. What did I leave out? I'm sure there's a lot that you could add to that, Dr. Ajay.
Yeah, so in general, if you're seeing your primary care doctor for something and they recommend that you must see a urologist, we're happy to see patients. I would assume patients who have difficulty with voiding and are interested in seeing us sort of electively.
I have to stop you there, doctor, and I'm so sorry. Voiding is the medical term, but I think we out in the world would say urinate.
Urinating, peeing.
Apologies
pissing.
for correcting you.
Yes, sounds good. So those are the main sort of conditions that we see. I would like to provide our scheduling phone number, if that's okay.
Sure, go ahead.
It's 607-385-3831. I'm going to be seeing patients here on Thursdays in clinic and possibly some Tuesdays. And as we start expanding, we might offer some telemedicine services as well.
Really? If I could stop you there and tell us, telemedicine, that's something that's come in the last few years, I believe. Is it, would you use something like a Skype where you can talk back and forth, the patient and doctor, and the patient is home? Kate Kreger, go ahead and jump in on this one.
Out at the new medical office building, we have the technology built into the building there to allow us to do what's called telemedicine or telehealth consults. So the patient would sit at this end in Hornell in front of the monitor, and through the beauty of electronics would consult with a specialist at the U of R, so that there are certain things that telemedicine really lends itself to, things like dermatology and rheumatology and some of the and neurology as well, where you just need to talk with a specialist, but it saves you having to make an appointment and drive up to the medical center.
I would imagine that would be great if you were living in a place like Jasper, where you're, in between Hornell and Corning, and let's say you lived in St. James, you lived in Jasper and you wanted an appointment with St. James, and it wasn't absolutely necessary that you be in the office.
Right. Well, the telemedicine technology is in our medical office building, so you would come to the medical office building to then consult with a specialist at the U of R. So we're just getting that capability up and running, and we're continuing to evaluate what types of specialties make sense for us to offer that consult type of service here so that patients don't have to travel for a consult.
No, it sounds like a great thing, and sounds like, practically everything except maybe a dentist. Would a dentist use telemedicine?
So for an initial consult, anyone can use telemedicine. So
Okay.
I could speak to somebody over a telemedicine appointment about what it means to have an elevated PSA or what it means to have blood in your urine,
Sure.
and do an interview. But then, we could follow that up with an in-person visit where you do a physical examination, possibly a cystoscopy, which is a test where we look inside your bladder with a camera, etc. But it helps you establish a relationship with the patient such that the first time you're seeing them is you're not performing a procedure, which can, sometimes be difficult.
Okay, we're down to the last couple of minutes here with Dr. Divya Ajay, the new urologist at St. James, and Kate Kreger. Was there anything I did not bring up that either of you would like to talk about?
Let's see.
No, Brian, I think you've done a really good job, and I appreciate the opportunity to come out and talk to you. We are very excited to be providing a whole gamut of urological services here, and we hope to provide really excellent quality care for patients here. And whether it's through primary care or whether patients decide themselves they want to come see us, we would love if you can contact us at 607 385-3831 to make an appointment with us. Like I said, we see patients on Thursdays at the medical office building at 7309 Seneca Point Road, Suite 102 in Hornell, and look forward to meeting you.
Well, thank you so much, Dr. Divya Ajay and Kate Kreger from St. James Hospital. And thank you for stopping in.
Okay,
Thank
Brian,
you.
we appreciate it.
It's AM 1480 WLEA Hornell. Brian Kilmeade's next.